or salad greens as a potential source of the outbreak of cyclospora cases that they're seeing in their state. Now, they also say that other foods cannot be completely ruled out, and their investigation is ongoing. They also mentioned that no specific grower or specific supplier has been identified yet, but this is significant progress in their investigation in a state where more than 2,600 people have gotten sick with cyclospora infections, and among them, at least 44 people have been hospitalized. And while this outbreak in Michigan is getting a lot of attention, separately, there have been separate cases of cyclospora that have been reported across more than half of states in the U.S. 31 states total have reported cases so far recently this summer. And we do know the symptoms to watch for include watery diarrhea. That's the most common. Sometimes it's explosive diarrhea, cramping, bloating, loss of appetite, nausea, fatigue. For many people who do end up hospitalized, it's usually because those symptoms have led to dehydration. Now, this infection, it can be treated with a combination antibiotic, but of course, you want to avoid getting sick in the first place. In the state of Michigan, health officials have recommended to reduce the risk, you can purchase whole heads of lettuce and discard those outer layers, thoroughly wash those inner layers. And they also say to prioritize cooking your greens if you can. Again, we do know that in some cases, people can become infected by ingesting contaminated food. That's food that may be contaminated with feces. So thoroughly washing your fresh produce is significantly important to reduce your risk. Back to you.
We're going to get more on this outbreak. Let's bring in Dr. Natasha Bagdasarian, Chief Medical Executive in the state of Michigan. Really appreciate your time. I know how busy you are at the moment. I was interested in our report there, how the map of the US, there's lots of cases. There have been lots of cases across the United States, which maybe doesn't suggest this is coming from one supplier. So what sort of investigations are you having to do here?
Well, as of this morning, we actually have over 3,300 cases in Michigan alone, and we've interviewed about 1,000 of those individuals. So we've done in-depth food histories, looking at where they've eaten, what restaurants, fast food places, and where they grocery shops. And one of the things that has come up over and over again is lettuce. So lettuce does seem to be one of our early indicators as a possible source. Now, that doesn't rule other things out. And we know that a lot of the lettuce suppliers supply their produce regionally or even nationally. So it's possible that some of these cases in other states are linked here to Michigan.
So what are you doing? Going to those suppliers and testing them? How does it work?
Well, we can only do whatever we can here in the state of Michigan. We don't have access to other states' data. So we're really counting on our federal partners at the CDC and FDA to do that type of investigation. And hopefully more information will be coming from them soon.
Are they doing it?
Well, I think people are doing the best they can in a very difficult environment. In 2025 and 2026, we saw federal cuts to public health. Those trickled down and impacted us here at the state and even at local levels. So people are doing the best they can in a very difficult financial and staffing environment.
I understand that, but budgets are needed, aren't they, in emergency situations like this, because you have to act swiftly. But these cuts at the federal level are causing a problem, aren't they? Because because the way the United States operates, of course, is you've got these regional bodies, but they do have to be coordinated at the federal level, and that's tough when they don't have the right resources.
Well, most of our funding here at the state level does come from our colleagues at the CDC, and then we distribute a lot of our funding down to the local level. So we need that funding, we need that infrastructure at the national level to remain strong. And we are not only dealing with Cyclospora, we're dealing with outbreaks of measles and mumps and pertussis. We're also doing symptom monitoring for people who are returning from countries with Ebola. So there is a lot of demands on public health right now. And financial resources are really stretched.
What's your concern? Because, all these illnesses do have a tipping point, don't they? So how do you monitor that? And at what point do you get very concerned that, it's very hard for you to control it with just one state's resources?
Well, in terms of what we're doing here, we've issued guidance and we've issued specific recommendations around how to handle your produce. But we know that the incubation period for Cyclospora is quite long. It can be up to 2 weeks. So the cases that are being reported to us today, they're likely individuals who were exposed to Cyclospora 2 weeks ago, maybe even longer. So it's going to take some time for our input, for our recommendations to really have any impact. It's possible that the contaminated produce is already gone from shelves. But again, that delay could mean that we're seeing cases now. So we are watching very closely. We're making sure that the numbers aren't growing too much. But yes, this is concerning.
Doc, how serious is this outbreak compared to others you've seen in recent years?
Well, it can be very serious, mainly because of the fact that we're seeing mainly 10 to up to 20 times the number of cases we typically see this time of year, but also those that are higher risk, especially those with chronic medical conditions, the elderly, those that are prone to dehydration. And now we're dealing with this during the hottest months of the year when we have higher risk of dehydration anyway. And then you combine that with a lot of people traveling, the World Cup, America 250, a lot of reasons people can be spreading this infection. And anytime you have a doctor that's on TV talking about explosive diarrhea, it is not a good time to be going out and about and having that fresh salad. So the key here is to making sure that you prevent with washing those greens, washing any lettuce or anything raw thoroughly. Wash your hands, soap and water. This is not one that is knocked out by your hand sanitizer. So doing everything that you can to decrease that spread. If you have concerns, following up with your doctor, and more severe concerns, especially altered mental status, dehydration, anything like that, check into the ED. We can get it checked out, hopefully get you supportive care. But this does, right now, the standard of care is an antibiotic therapy for this, lasting about a week to 10 days. If not treated, it can bounce back and forth for up to weeks. So this is a serious situation in thousands of cases around the country.
So just to be clear, people should not eat salad anymore? What exactly is the instruction?
No, definitely, you can still eat salads. We just want to make sure, especially if preparing at home, you want to make sure that it is thoroughly cleaned and wash those greens before you consume them. That's standard. We recommend that year round, even if we don't have a cyclosporiasis outbreak going on. We, at this point, don't want to decrease people's intake of healthy foods. We just want to make sure that you're taking them in safely when you eat them. So wash them, clean them. There's a lot of products out there that you can use, and eat safely. Seek help if you need it.
And in terms of washing hands, what do you mean? Like how often? I assume you mean back to like COVID era washing of hands where you're doing it between the fingers and thoroughly and up the wrists and everything for like a minute. Just what, 5 times a day? Anytime you go outside, anytime you're in public, how often?
I would use anytime you've been out in public for a while, definitely every time you've used the restroom, and before you eat. Anytime before you eat, that's the most important. Wash those hands, soap and water. Exactly. This harkens back to the COVID days, but instead of having an airway-based infection, this is a fecal oral infection where we have contamination and the potential of spread that way. I also encourage you that if you're around a buffet where you're using utensils that are common use, wash your hands before you eat your food. That's where a lot of these are transmitted. It's from contaminated utensils that are then spread from person to person.
How hard is it for health officials to track these cases to pinpoint the cause of transmission? I mean, this originated from some one person or cow or something, right?
Theoretically, some of this is naturally occurring from farms, from produce or water supply. It could be a lot of different places. 31 states at this point are involved. 5,000 cases are being investigated. So a ton is out there. Narrowing it down is going to make a huge difference, because then you can get that off the shelves and actually get back to hopefully allowing everybody to eat the rest of the food that's out there. But making sure tracking this is very difficult. For one, not everybody can test for this. Two, it takes a while for the symptoms to develop, and a lot of people thinks it's just a GI illness, the stomach flu, or whatever it may be. And then also our public health